Now this video segment is regarding the echogenicity of the liver parenchyma, rather the liver parenchyma, whether it is normal or it's not normal. First we will consider this fact. I am going to inform you that this is a normal liver parenchyma by all parameters. You should keep in your mind the degree of echo brightness that is normally seen in the liver, which is normal. This is the outer surface, smooth, and now let's compare it with the right kidney, Rambasalo, Roko. Now when we compare it with the right kidney, parenchyma, you must note that this is the liver parenchyma and this is the renal parenchyma. In this case, the echogenicity of the liver is almost equal to that of the renal parenchyma, and this is considered to be normal. Now if you see that the liver parenchyma is slightly more or equal to that of the right kidney, then it is we will say that the liver has normal parenchymal echogenicity, no coarseness, homogeneous texture. In this case we will also see the shape of the gallbladder wall. It will be thin, regular in case if the gallbladder is normal. And now see the portal vein, the periportal echoes. These are the normal periportal echoes. This is the portal vein, and see the vessel margins and the sharpness of the vessel margins. This is the hepatic vein from one angle. Here we see the middle hepatic vein. Note that the sharpness of the vessel margins, very sharp vessel margins. See the margins, see the periportal echo brightness. Magnifying. This is the hepatic vein with no echogenic border around it, and this is the portal vein with echogenic borders around it. See the vessel, no echogenic border. This is hepatic vein. This is the portal vein because it has echogenic border around its anterior wall, and these are called the periportal echoes. This is what you will see in normal liver, in the liver which has normal parenchymal echogenicity, or whose parenchyma is normal, or the liver is normal by all parameters. A margin of the liver will be sharp. It will be sharp and less than 45 degrees. This is the margin of the liver that you can see is sharp. Now this is the left lobe of the liver in longitudinal section, and this is the caudate lobe. This is the Ligamentum Venosum. This is the IVC. This is the portal vein. From inner to inner, measuring 11.1. Now, this is the ligamentum venosum, forward lobe, left lobe of the liver in transverse section, ascending portion of the left portal vein, the muscle. Now here you can see that both right and left portal veins together. With normal periportal like this.
ठीक है
सर नहीं लंबा सा बस रोक लो. Now another interesting thing to note is that the brightness of the liver parenchyma will remain the same throughout up to the diaphragm. There will be no diminution or attenuation of the sound waves. They will pass equally throughout the liver parenchyma, and this is the normal liver thickness and brightness. Diaphragmatic, this is right hemidiaphragm. This will be the normal diaphragmatic echo brightness and thickness, and the liver echogenicity will be the same throughout. So this is a study of a normal liver, because until and unless we are well acquainted with the normal, what a normal liver looks like, we will not be able to differentiate between the pathological liver. Thank you. Now this video segment is regarding the echogenicity of the liver parenchyma, rather the liver parenchyma, whether it is normal or it's not normal. First we will consider this fact. I am going to inform you that this is a normal liver parenchyma by all parameters. You should keep in your mind the degree of echo brightness that is normally seen in the liver, which is normal. This is the outer surface, smooth, and now let's compare it with the right kidney, the masalo roko. Now when we compare it with the right kidney, parenchyma, you will note that this is the liver parenchyma and this is the renal parenchyma. In this case, the echogenicity of the liver is almost equal to that of the renal parenchyma, and this is considered to be normal. Now if you see that the liver parenchyma is slightly more or equal to that of the right kidney, then it is we will say that the liver has normal parenchymal echogenicity, no coarseness, homogeneous texture. In this case we will also see the shape of the gallbladder wall. It will be thin, regular in case if the gallbladder is normal. And now see the portal vein, the periportal echoes. These are the normal periportal echoes. This is the portal vein, and see the vessel margins and the sharpness of the vessel margins. This is the hepatic vein from one angle. Here we see the middle hepatic vein. Note that the sharpness of the vessel margins. very sharp vessel margins. See the margins. See the periportal eco-brightness. Magnifying. This is the hepatic vein with no ecogenic border around it, and this is the portal vein with ecogenic borders around it. See the vessel, no ecogenic border. This is hepatic vein. This is the portal vein because it has ecogenic border around its anterior wall, and these are called the periportal echoes. This is what you will see in normal liver, in the liver which has normal parenchymal ecogenicity, or whose parenchyma is normal, or the liver is normal by all parameters. A margin of the liver will be sharp. It will be sharp and less than 45 degrees. This is the margin of the liver that you can see is sharp. Now this is the left lobe of the liver in longitudinal section, and this is the caudate lobe. This is the Ligamentum Venosum. This is the IVC. This is the portal vein from inner to inner, measuring 11.1. Now, this is the Ligamentum Venosum, caudate lobe, left lobe of the liver in transverse section, ascending portion of the left portal vein, Now here you can see that both right and left portal veins together. With normal periportal echoes.
ठीक है
सर नहीं लंबा सा बस रोक लो. Now another interesting thing to note is that the brightness of the liver parenchyma will remain the same throughout up to the diaphragm. There will be no diminution or attenuation of the sound waves. They will pass equally throughout the liver parenchyma, and this is the normal liver thickness and brightness. Diaphragmatic, this is right hemidiaphragm. This will be the normal diaphragmatic eco-brightness and thickness, and the liver ecogenicity will be the same throughout. So this is a study of a normal liver, because until and unless we are well acquainted with the normal, what a normal liver looks like, we will not be able to differentiate between the pathological liver. Thank you. This study is regarding the parenchyma of the liver. This is a liver with level 1 fatty changes because of the reason that एक लंबा साल है कि बेटा सार होता है. That if you see that the parenchyma of the right kidney appears black, and that of the adjacent liver is increased, has increased parenchymal ecogenicity with no significant coarseness. So simple diffuse increased parenchymal ecogenicity of the liver with the darkness of the reduced appearing reduced. Parenchymal lipogenicity of the right kidney with thinned out parenchyma and blackness of the area adjacent to the diaphragm is suggestive of a fatty liver without coarseness. There is no coarseness in the liver. Liver is smooth, homogeneously equilibrium. The periportal echoes remain intact in fatty liver, simple fatty liver. As you can see, this is the portal vein and the periportal echoes are intact, as they should be. Now, here you can see the blackness of the. Now the kidney is not showing blackness or decreased parenchymal lipogenicity because of some disease process in the kidney. It is because of the fatty liver anterior to it absorbing the waves as they reach so that as the waves reach this portion, they get attenuated. And if you see the vessel margins, especially those of the right hepatic vein, of the hepatic vessels, you will see sharpness of the vessels. There is no blurring and no loss of vessel margin. Lambasa, dinazora, and see the liver is showing relatively thin equigenicity. This is the liver and it's relatively thinned out with the, otherwise this portion of the liver that is close to the diaphragm is showing diffuse decreased parenchymal equigenicity compared to the superior part of the liver. Now this is the superior portion showing increased equigenicity, no coarseness, and this area adjacent to the diaphragm is showing blackness, or rather diffuse decreased equigenicity, because the fat is being, the sound waves are being absorbed in this portion. By the time they reach this area, they are so weak that when they go back, they give this image. And see, the outer surface of the liver is smooth. In fatty liver, the outer surface will be smooth and regular. The wall of the gallbladder will be normal, as seen in normal cases. So this is a case of fatty liver parenchymal kidneys. Level 1, you can say. Number 7. You can see the homogeneity of the parenchymal equigenicity raised, but the parenchyma does not show any coarseness. Outer surface is smooth. The rest of the findings I have narrated. Thank you very much. This is a video study of level 1 fatty liver. As number 1, you can see that the parenchyma of the liver shows diffuse increased parenchymal equigenicity without any coarseness. This is the diaphragm, it's appearing papery thin, and the area of the liver adjacent to the diaphragm is appearing black because the fat is absorbing fat absorbs the sound waves very rapidly. So by the time they reach the diaphragm, they are attenuated, can go weak to the extent that this area then appears black. Number 1, then number 2. Okay, let's compare it with the kidney, and you can see that the parenchyma of the kidney is appearing black, not because of the disease process, rather because of the sound waves being absorbed by the fat in the liver. Now this is the fatty liver anteriorly, the outer surface is smooth. This is the thin diaphragm. See the attenuation of sound waves has reached this area because of the fatty liver anterior to this part. Let's see the gallbladder wall. The gallbladder shows normal wall. Here you see this is the normal wall. These periportal echoes are mildly attenuated, otherwise the periportal echoes are intact. Intact in the sense that they are seen, the brightness is seen around the margin of the portal vein, but it is a bit dim or attenuated as compared to the normal because of the adjacent fat in the liver. This is the transverse section, again showing you a black kidney because of the fatty liver. So this is the case of level 1 fatty liver. See the vessel margins show sharpness, they are not blurred. लंबा साल है कि बेटा साल. So this is the case of level 1 fatty liver. Thank you. Comparing the liver parenchyma with that of the right kidney, we see the black parenchyma of the right kidney, and this is because of the fat and the liver and the thin diaphragm, low echogenicity adjacent to the diaphragm because of the sound waves being absorbed rapidly by the fat in the superior region of the liver, so that by the time it reaches the diaphragm, it becomes so weak. When it returns back to the transducer, you get this image. Now, same is the case of explanation for the blackness of the renal parenchyma, which is otherwise normal. So in fatty liver, you will see this sort of a picture depending upon the fat in the liver. If the fat is less, you may see a normal parenchyma of the kidney. Second point, now you can see that the parenchyma is seen papery thin, and its upper portion appears bright, lower is dark. So there will be variations between patient to patient. This is for the analysis of the periportal echoes. You see this is the portal vein, and the periportal echoes are relatively attenuated. They are not that sharp, and they are not brighter as they are seen in the normal cases. Now the hepatic veins in level 1 fatty liver will appear sharp. Their margins will be sharp, as you are seeing here. You can note the sharpness of the vessel margins in this fatty liver. This is the hepatic vein, and you can see that the margin is sharp. So this is a level 1 fatty liver by all these parameters. Thank you. Now on the left side of your screen is the normal liver. This is the normal liver parenchyma. This is the normal kidney. See that the co-difference between the liver and the parenchyma of the right kidney is like. The difference is that the echogenicity of the liver parenchyma is normal and slightly raised as compared to that of the normal right kidney parenchyma. However, if the parenchyma of the liver, the echogenicity of the liver parenchyma and that of the renal parenchyma are equal, that we will also consider as normal. Ideally, if you see the mild decrease in the echogenicity of the liver, as we are seeing in this segment, is an indicative, suggestive of normalcy. Now this is a liver with normal parenchymal echogenicity, as it should be, homogeneous texture and sharp vessel margins, smooth outer surface. Now I'm going to show you another liver. And you see that this liver shows Sambasaya, Now in this liver we also see the same findings as we saw here, that the echogenicity of the kidney is less compared to the adjacent liver parenchyma, but the echogenicity is more as compared to the normal, expected normal. The outer surface is smooth. The echogenicity of the liver is homogeneously increased, and the texture is smooth. There is no coarseness, and there is this decrease in the parenchymal echo brightness or echogenicity is because of the fat in this liver. So this is a relative fatty liver. Now you can see that in this liver, the vessel margin sharpness is preserved relatively, and you will see that as you approach the diaphragm, you see that the parenchyma of the kidney shows attenuation of the echo brightness. Now this is the normal, and see this. This is the smooth outer surface, increased echogenicity, and this area adjacent to the diaphragm appears relatively black because of the fatty liver above. Fat in the liver above it. Now see that the periportal echoes are not that prominent as we see in normal patients, in normal persons, sorry. This is the portal vein. And you can see that the periportal echoes are less as compared to seeing in normal person. Lambasala ke saru proposal. This is the ascending portion of the left portal vein. These are the branches of the portal vein in the left lobe of the liver, and see if the echo brightness of both the vessels have gone down. Well, this is the case of fatty liver, that to level 1. This is the gallbladder, and you can see that the wall of the gallbladder is normal, and these are the here we again see decrease in the periportal echoes, the outer surface smooth. So these findings are consistent with the fatty liver, level 1 fatty liver. Thank you. Now this liver is fatty indeed, shows sharp angle, smooth outer surface, diffuse increased parenchymal echogenicity, no coarseness. However, the muscle of the liver adjacent to the diaphragm shows diffuse decrease in echogenic blackness rather, and the diaphragm is thinned out. This favors the fatty liver, and the more the liver is fatty, the more this area above the diaphragm will appear black to you because of the absorption of the sound waves from the fat is rapid, and by the time they reach this area, they are attenuated, and this is the gallbladder. So fatty liver, the muscle, roko, and if you see the vessel margins, they are blurred. My routine is when I see a liver of this ecogenicity and texture, and with blurred vessel margins, I label such liver as well as if it shows diffuse decrease, attenuation of the periportal echoes. As you can see that in this case, the periportal echoes are gone down. This is the portal vein. These are the periportal echoes which have gone down. They are not that bright as we see in normal cases. This is the left lobe of the liver in transverse section. And you can see that the degree of echo brightness at the borders of the hepatic of the portal vein is not that bright as normally we do see in normal cases. Now, with the diffuse increased parenchymal echogenicity, area around the above the diaphragm appearing black, with the decreased periportal echoes, and these are the periportal echoes. This is the portal vein with the blurred vessel margins, that of the hepatic veins mainly, is suggestive of a level 2 fatty liver. Thank you. Now you can say that, well, this is a fatty liver, that will be enough. But if you want to give further grading, then is it level 1 or level 2 fatty liver? So the parameters that make it a level 2 fatty liver is decreased periportal echoes of that of the portal vein, blurred vessel margins, that of the hepatic vein. Here you see the vessel margins are blurred, and here you can see this is the caudate lobe of liver, this one left lobe of liver, outer surface. So this is in fact the masala because we see the black renal parenchyma. So this is in fact finding that is consistent with level 1 fatty liver. Thank you. Now this is a liver segment, a liver in front of you. We will study in a few segments the parenchyma of the liver. Now, what can be said about the parenchyma of this patient, liver of this person? Here, we will compare the echo brightness of the liver with that of the right kidney. This is the right kidney, and this is the liver. Shows diffuse increased parenchymal echogenicity. Well, लंबा सा रोकिए. This is the diaphragm basically, and I am going to show you. See the solid. This is the diaphragm. आराम से सांस लें, आराम से. And this is the portal vein. This is the liver. This is the portal vein. Here you note the periportal echoes. Observe the vessel margins in this view. Are they sharp or blurred? Note the Now this is the middle hepatic vein, this area. This is the middle hepatic vein. Note its margins are blurred or sharp. Note the gallbladder wall. Now these findings are consistent with grade 2 fatty liver parenchymal changes. This is the outer surface of the liver. Now you see that the vessel margins are in fact blurred. They are not sharp, they are blurred. The periportal echoes are decreased compared to that of the normal, steady. These are the periportal echoes. The parenchyma of the kidney and compared with the liver shows that the parenchyma of the right kidney, the echogenicity of this has gone down a bit as compared to that of the fatty liver anterior to it. Wall of the gallbladder is not thick. And here you see papery thin diaphragm. This is the papery thin diaphragm. Here the echogenicity is bright. As we approach the diaphragm, it fades out, becomes black, consistent with fatty liver. Level 2, because of all the other parameters that I have shown you. So this is a level 2 fatty liver parenchymal changes. This is a video segment to show you a difference between a fatty liver and a cirrhotic liver. You can see that on the left side of your right side of your screen is a cirrhotic liver, in a sense that you can see irregularity of the outer surface, diffuse increased parenchymal echogenicity, coarseness all over. And this is a case of fatty liver. You can see that the outer surface is smooth the outer surface is smooth of this liver. Compare the outer surface of this liver and the outer surface of this liver. This is irregular in outline. This is regular in outline. This shows diffuse increased parenchymal echogenicity with the coarseness. This does show diffuse increased parenchymal echogenicity, but the coarseness is not there. लंबा साल है कि सालों की. So this is a case of fatty liver. With smooth outer surface.